very briefly introduce our three speakers. I already said something about Bill Savedoff. He's a senior fellow here at the Center for Global Development. Many of you will, I think everyone has bios, so I'll just explain in case you're not sure which one is which. Bill Savedoff is there. Suzanne Duryea is an economist or a senior economist or a distinguished economist or a research, whatever she's called, at the Inter-American Development Bank, and I remember her work very well from my years there. And it's really nice to have her here. And Scott Rozelle is probably a professor at Stanford University and probably well known to all of you in the in the evaluation community. So I think we start off with Bill. We have each speaker make his or her presentation, and then we'll have discussions and Q&A with the audience. Bill, you go first.
Thanks, Nancy. Thank you. So I wanted to, first of all, welcome everybody to the event. I remember when I first started, before we started the Evaluation Gap Working Group, having conversations with people and saying, why is anybody going to be interested in talking about rigorous research? This is such a boring topic. You'll never get anybody interested. We did get, people are clearly interested, and I keep thinking that, well, CGD's done what it's going to do in it, that's enough. We thought we'd get maybe 30 or 40 people together for an interesting discussion about the state of impact evaluation, and then we were oversubscribed. So as you can see, there's a lot of interest in this topic. So I don't need to do a lot in the way of motivation of why we're here, but I thought what I would try to do is I've been sort of observing what's been happening in the impact evaluation world for the last 10, 15 years, and I'll give you my perspective, my story, sort of how I've seen it. I've done a little bit of analysis to see if my views are completely off the wall, and I'll share that with you. And then just a few notes about where we might be going from here. And that's essentially also parallel to what the day is about. It's to get a sense of what's going on with the evaluation world and an idea of what can we do. There has been a lot of positive change. What can we do to make this learning process that we're all in together work more and better? So why did we ever talk about an evaluation gap in the first place? There are people I know who teach in Cambridge, Massachusetts, who think that there is no longer an evaluation gap. The evaluation is coming out of their ears. But everyone has their own story, and I thought just instead of me speaking up here, I'd give you guys a chance to turn to the person next to you, if you can find somebody that makes sense, and just briefly, I'll give you a minute, to say, sort of just to think back, what was the first time that you either heard the word impact evaluation and got intrigued, or why you think you started getting interested in this field? And just a chance, say, give the person your name, and then you can just say one thing about why you think you're interested in impact evaluation.
The paper was actually, been translated into When Would I Ever Learn? We actually, Howard gave I work on China, and so we did a big impact evaluation conference there, and that was translated. And you will see, it changes the way the government deals with research.
Right, so they might be ahead of the U.S.
in
reference to what
far
I said.
ahead. Exactly.
You should say that.
Definitely.
So that's the working group. I think I'd heard impact evaluation before that working group started its work, but not much.
Yeah, I heard it. Being in development, right, part of the action plan, right? They came out in early 2000s or something like that.
Yeah, because that's what was on the working group, and it already...
Yeah, they were around at that time.
Evaluation, of course. And I have this paper, 7 Deadly Sins of the Donors, and what to do.
That's a great paper.
And one of the deadly sins was the lack of evaluation. But impact evaluation as a concept is only in the last 10 years.
Right. Yeah, any UDC started having impact evaluation Might be talking about dinner.
Are you going to get?
Great.
Are you going to get
that
the
was a-
average date or median date?
No. Nancy was asking if we should collect the date on which everybody mentioned this and sort of find the average. But maybe we can do that later in the group sessions in the afternoon. So now we've basically shared about 100 stories about how this all came about. I would love to have been able to be a fly on the wall for each one. I'll just share, and in some ways, if I came up with that story, I'd have to come up with several different sort of moments. But I think one of the really striking ones for me was in the Inter-American Development Bank in the mid-90s when we were doing an education sector strategy. And somebody calculated that the IDB had funded training for 1 out of every 5 teachers in Latin America. And we had almost no idea of whether that training had affected learning. We didn't know if the training had affected the teachers, what they did. And even more, we didn't even know if one method was better than another. I mean, any of those questions couldn't be answered. So that's where sort of the word evaluation gap really sort of, one of those moments where it really hit me. The narrative that I usually give about the evaluation gap starts with Millions Saved. It was a working group the CGG set up to combat donor fatigue. In the early 2000s, you may not remember, but people were saying, we're tired of donating money. Aren't there any successes out there? The working group asked experts to identify successful public health interventions. They got 56 examples. 17 were identified and documented and showed up in the book, and that's a whole other story that you can look at. But the part that I want to emphasize is 12 of them were excluded because they were too early or small scale. They just didn't seem to fit the criteria. But the important part was 27 of them were thought to be big scale and important, but the documentation wasn't there to really say these things had an impact. Experts think so, but we don't have the documentation. And this is not using some standard of, some very narrow standard of methodological rigor. If you look at the book, you'll find examples that include experimental studies, quasi-experimental studies, but also studies like the one on Sri Lanka's reduction of maternal mortality, which is a long time series, and trying to look through plausible explanations for the decline in maternal mortality, and really finding through a series of researches that the public policy programs were an important contribution to that. So it's that 27th. This is where and Dan Kress was involved in this, Raj Shah, Ruth Levine, Smita Singh, others. I'm sorry, not Smita comes later. Raj Shah and Dan Kress in the working group were looking at this and said, if we come back 10 years from now to do another version of Millions Saved, we don't want to have to throw out all these cases because we don't have the documentation. And that's kind of the real motivation for the Evaluation Gap Working Group. I'm just going to mention 2 things that came out of the Evaluation Gap Working Group. Smita Singh was involved in that, and Richard Manning was involved in that. Probably others of you here. I don't have the full list in my head at the moment. But I want to just take 2 things out of that process. One was we got really stuck in methodological debates. And people still get stuck in methodological debates. And one of the things that we got out of that working group, and I particularly remember talking to Steph Bertozzi, who said he never has an argument with anybody about methodology once you're talking about a specific research question in a specific context. If you're asking about trade policy in Kenya, people do not propose a random assignment study. It doesn't happen. And if you're talking about how you're going to get kids from, kids in school to master numbers and whether it's better to use building blocks or cards or pencil, random assignment does come up. So this phrase that came out of the working group to me is the one that sort of the mantra that I use. I'll start with the question and choose the method which is most appropriate, feasible, and rigorous to answer it. And then the 2 recommendations that came out of the Evaluation Gap Working Group were in the category of what can organizations already out there do, because we're not the only picture out there, and then our reasons we felt there really needed to be a new independent facility to promote more and better quality studies. And the reason we thought that there was a need for a new independent group is that most impact evaluation was being done by organizations of their own projects. And when you're doing your own projects, you need to have the scale of, say, the World Bank to have the intellectual as well as financial resources to have any impact on building knowledge. But if you think about all the agencies in the world and all the countries in the world that are doing all kinds of interventions, similar interventions, if you split the impact evaluation process from the program evaluation process, you can be selective. You can concentrate resources on the places where you learn the most, and you can be independent and credible. At the same time, though, you don't want to be completely split off. You have to link into projects so that the questions are relevant, so that the data collection is appropriate, and so that your conclusions can be rigorous. And so this was the kind of challenge that we thought that a new entity could help move forward. And so in 2009, we have the creation of 3IE. It was so simple. We just turned a switch, and there it was. That's another story. But 3IE is up and operating. It's done a fabulous job under, I think Howard White's done a remarkable job pulling it forward, and all the people have been involved in the board and the agencies that have supported it. And I had a few notes here about what it just sort of, it's up to about $6 million annually in terms of funding studies. There are about 130 studies in process right now. And what I'm particularly proud of is that the number of developing country members has increased. When I looked at the website, there were 7. Howard's informed me that there are about 3 more about to sign on, and an additional 3 beyond that who are likely. And that, to me, is where the real guts of this is. It's the countries themselves knowing that this kind of information is going to be useful to them in their policy. Is there really more impact evaluation happening? This is data from, this is taking the 3IE database of impact evaluations. So they've gone through a process of looking through all kinds of databases to identify studies that would qualify as impact evaluations according to their standard of what an impact evaluation is and methodologies and so forth. And I just threw this up. This is up through 2011. And the 3 points I want to take from this. First of all, you can see there's practically a tripling of the number of evaluations out there from 2008 until now, from about 40 to 120. So tripling of the number. So my impression that there's a lot more impact evaluation, it holds up. The second thing is it's only 120. Now, to some people that may be a lot of studies, but when I think of there being about 80 countries that I'm interested in the world, maybe 20 sectors in which development is being done, another, say, 50 possible interventions that you could assess in each one of those sectors, this to me is still a fairly small number. So I take 2 things. We're making progress. There's more to go. And then the final point I wanted to make is that this is not one organization's doing. We have efforts to get impact evaluation moving back with OECD expert groups in the 80s. The progressive studies that came out of Mexico, I think, were a really key sort of moment in impact evaluation history for developing countries because it put it on the map. JPAL started in 2003, the evaluation gap in 2004, the World Bank's Impact DIME initiative, and then 3IE. So this is a collective enterprise. Because I didn't trust that the impact evaluation database of 3IE was unbiased, I decided to do an independent tally, very quick and dirty, with the Journal of Economic Literature, and it came up pretty much the same. That's the purpose of that slide. So just to show you, you need independent verification. Holds up. The point of this slide, out of that database of 700, 800 impact evaluations, it also confirms my sense that most of these studies are in social protection, in health and education, very few, many fewer in environment, urban development, or energy. Within social protection, it's mostly conditional cash transfers, also not a big surprise. And then on methods, these studies, in terms of the quantitative methodology, All methods are increasing. There's more difference in difference. There's more instrumental variable. There's more regression discontinuity. But clearly the big expansion has been in experimental studies, in RCTs. There's still only slightly more than half of this annual production, but I think they will probably continue to be more than half heading forward, unless we start asking more questions and funding studies that are asking questions that are better answered by other methods. So I'll conclude by saying, where should we be going? My input, for those of you who sit at my table this afternoon in the group session, you'll hear this again. Basically, more is better. We do need more. And I'm not saying more of this kind of method or that kind of method. It's more studies where we ask clear questions that can be answered rigorously. Most of these we're talking about, I would consider micro studies. They're not system studies. But again, we need more micro studies answered. We can't answer system questions if we don't understand underlying behavior and stuff. Fitting evidence together is very critical. Systemic reviews are one part of that process, but more thinking and synthesis is needed. I've asked, if you go outside, you'll see there's a book, Due Diligence, by David Rudman about microfinance. To me, that's probably the best example today of a book where somebody took all the different evidence, needed experimental, quasi-experimental, and interviews and anthropological work, and pulled together a very cogent analysis of what's going on in microfinance. And finally, the public goods that we need to do to support all this work. Clustering of studies, replication of studies, standards, pre-registration. That'll be the subject of the final session. So thank you for coming. Thank you for participating. And I'm looking forward to hearing what you all have to say about these things through the day. Thank you.
Thank you very much, Bill. That was a great start. Nothing like evidence to influence our discussion of evidence. Before we turn to the next speaker, I wanted to introduce a couple of people whom I only noticed or who snuck in late. We have a founding board member here, Carol Lancaster. Welcome, Carol. And Smita Singh, who, when she was at the Hewlett Foundation, supported not only financially, but analytically and cheerfully and importantly and intelligently the work that we did at CGD on that report, When Will We Ever Learn? Finally, so I don't forget, Bill, I want to ask you later when we come to the Q&A, do you think the organization should have been called the Quadruple IE? International Initiative for Independent Impact Evaluation. Okay, let's turn now to Suzanne Duryea.
Good morning. Thank you for the opportunity to reflect on developments in impact evaluation. I want to make clear that I'm making personal reflections and I'm not making an official position of the Inter-American Development Bank. I'm going to keep this presentation short. I'm going to focus on three things: recent developments in evaluation of IDB projects, some of the lessons we've learned, and then finish with some challenges. And before going to the trends, I want to say that the evolution of impact evaluation didn't occur in a vacuum in the IDB. This occurred within the context of a lot of dissemination efforts. This very groundbreaking book that was released, many training and capacity education efforts, and very importantly, within the context of our donors asking for more development effectiveness and accountability in our projects. So I'm going to start with something that's really more of a precursor to hardcore impact evaluation. Our development effectiveness unit puts together an index of how our projects can be evaluated. And so this is basically an assessment of the M&E potential of our projects. And so you can see that, so this is basically looking at whether there are indicators, whether the intervention proposed is related to the diagnosis. And so you can see that since 2008, this evaluability index has increased from 3% to 99%. So, and this is the percentage of projects that are assessed to be highly evaluable at entry. Now, more importantly, we've looked at how many projects, the percentage of projects that include plans for rigorous evaluations when they're approved. And since 2008, this has increased from 8% to 38% of our projects. This is a huge increase. And I want to make clear that when I talk about, rigorous evaluation plans, this means that the evaluation is considering a clear counterfactual so that, attribution can be addressed. So this is the evaluations here are either applying experimental or quasi-experimental techniques. And within these evaluations, over the same period, there's a strong shift towards the experimental designs. This is really just a shift in the paradigm at the IDB. Today, you would really be hard-pressed to walk through the hallways and say RCT and find someone who doesn't know what that means. Anecdotally, if you go back to 2006 when Bill wrote the book, I was able to go into my files and find a letter I had written to a research committee who had rejected a proposal for an excellent RCT design. And at that time, the knowledge of how important and useful impact evaluations was not ubiquitous at the bank. So, of course, I would like to attribute this increase to my very influential letter, but the fact is that's not the case. It's really from all of the efforts from the dissemination. There were a lot of training of high-level managers who were exposed to the benefits of impact evaluations, and you can see that in the overall programming and the work plan of the bank today. Within the research department, within the social sector, we did a recent audit of our loan projects, and I should say that the numbers that I just showed you were for the overall bank, and they were restricted to, public sector loans, which is the bulk of our work at the bank. And we did a similar exercise within the social sector of the IDB, and we found that we're currently running 40 rigorous impact evaluations related to our loans in the social sector. And this is a lot of work, considering that we have approximately 100 professional staff. So these are 40 ongoing big impact evaluations. In addition to the loans, we also do impact evaluations of our smaller grant programs. So we often do that when we're doing pilots and we want to see if the pilot has impact. Okay, so let me get to the lessons learned. I'm going to focus on just 2 lessons learned. The first is really how we form our evaluation teams. So if you go back 5-10 years, really the method was to outsource these big evaluations. The team leader would be involved in the negotiation with the typically government counterpart about the methodology, and then the terms of reference would be written. An external consulting firm or academic group would be hired, and then we'd get the evaluation back. And often, in the interim, the government team would change, something would fall apart, and we found that this way of working often didn't have the best results. Often the external teams had their own interests of publishing. They couldn't respond adequately to the high demands of the dialogue with the counterparts. And so we've modified our approach, and we call it really more of an insourcing of IDB evaluation expertise for our very strategic evaluations. So that means that we bring in someone who wasn't part of the project team, but who has, high capacity in evaluation to be part of the evaluation team. We still contract external consulting firms. We still contract, very high profile academic experts, but now we have more of an internal, external team that can follow the evaluation through the process, and this enables us to respond when something happens, when there's a change in the minister and you need to renegotiate often 5 times the original study design. It enables us to feed back the results of the evaluation into the program design, and so this is obviously not something we can do for every impact evaluation, so we restrict this to our very strategic evaluations. The second lesson is really related to the sharing of failures. Michael Kramer often talks about publication bias, and this is really related to implementation bias. Nobody really likes to talk about their horror stories and their failures, but there's really a lot to be learned from these good evaluations gone bad. What we've done to really lower the barriers and lower, the cost to exposing your ego, we formed a little informal group at the bank, and we called it Women of Power, in reference to power calculations. And this allowed us to, just very casually, informally share our experiences. And I can give you one example of something that came out of this little group. So it turns out that many of my colleagues had gone through a similar process of, successfully negotiating a rigorous evaluation design with the counterparts, had lined up a great evaluation team, had raised the money, they had, everything in place for a fabulous evaluation. And one of the first places things fell apart was in getting the list to randomize. So they had designed the protocol, the counterparts said there was excess demand, and then when it came time to get this list to randomize, there's 5 people on it and you don't have the sufficient numbers for your power calculations. So after hearing so many cases of this, for one evaluation we're doing in Venezuela, we decided to really keep track of this pre-registration process. And so we essentially have a live, real-time monitoring of the families that are signing up for the program. So we were able to really problem solve and say, okay, in these 5 centers, something's going on here. When the sign-up time closes, we're not going to have enough numbers. So we were able to, call them up and say, oh, look, there were torrential rains, you need 3 more weeks, we can extend the time. In others, we could find out that they didn't understand the process. And so at the end of the day, we did reach our numbers required for the power calculations, and we moved ahead with the study. So I think that's something that 3IE, other organizations can help us with, to have conferences on these epic fails. Okay, so finally to end with the remaining challenges. I've shown you all these numbers of more evaluations that are obviously financed and moving forward. So, how can I stand up here and say we still have financing problems? But I'm standing up here saying we still have problems with matching the financing with the timing of the projects. A lot of the money for our evaluations are coming out of the loans themselves. And what happens is there's a very long process of developing the loan, and when it gets approved, the counterparts, they want to implement the program. They don't want to hear that, oh, now we have to go through a procurement process to hire a survey firm, and we want you to wait so we can do the baseline. So please don't implement your program for 6 months because we want to do the baseline. And I just want to give a shout out to the MIF, because this is the Multilateral Investment Fund of the IDB that works with small private sector projects. What they've done is to basically tax their projects so that they have a fund available for strategic evaluation. And this is something that the IDB as a whole needs to have available, so that each evaluation isn't dependent on raising funds and getting this fund financing available, so you have the money when you need it. It needs to be much more strategic. Okay, so then the last challenges is really related to the fact that when you look across Latin America, there's really an uneven application of institutional review boards and human subject reviews. So whether a human subject review, IRB, happens is completely related to where the money's coming from, which country it is, and what the institutions and teams involved. When you're working with a great research team, they're going to know that they're cutting off future opportunities for funding by not doing an IRB. And they're cutting off future opportunities for publishing by not doing an IRB. But in many cases, these aren't happening. The knowledge that it's in the interest for the project to do this is not there. So this is another area where there's an opportunity for institutional strengthening of universities and other institutions in the region. Okay, so let me just finish by saying, this tremendous increase in the quantity and quality of impact evaluation really allows us to bring in more evidence-based policymaking into the programming of the IDB. Thank you.
Thank you, Suzanne. Scott.
Good. It's nice to be here. I'm at the Freeman Spogler Institute at Stanford and run a project called Rural Education Action Project, where we are basically an umbrella group sort of patterned after JPAL, but we work only in China and only on in poor rural areas and migrant communities, and very much targeted at sort of policy impacts. My assignment was to reflect on some of these questions. Are more studies being conducted? Are methods that are utilized changing over time? And are studies finding their ways into policies in developing countries, among others? I was actually given 15 to 20 minutes, and you know what that means to a professor. It's 20 to cheat to 23 or 24. So I'm actually going to just focus on 3 of these questions, and since Bill did a little bit on more studies being conducted, I'll try to rush over these. There's a great paper that's just come out by Patrick McEwen, and I have seen the numbers that Bill had put up before. I thought this was really good because basically what he did is he took one of the sectors, and which was education, randomized control and looked only at randomized control trials, education studies that looked at impact on learning, and he just looked at these. And I thought those numbers were fascinating. He actually went really deep into the literature, looked at hundreds and hundreds and hundreds of websites, and he found 76 just on education studies on learning. There's many, many more on outcome, on getting kids into school. And you can see that, if you look at over time, we've had twice as many studies in the 10 years after 2000 as in the 25 years before 2000. You can see that they're also penetrating. These are our China studies, right? That have come in. The Indonesia studies in some of the new Latin American countries. So they're penetrating into developing countries, and they're penetrating into new countries. And so I think that this is gaining momentum. The other thing that Patrick does is he then, he looks at different outcomes and different studies that and look at their effect sizes. And what we find is really starting to bring together sort of, this is treatment of education on teacher training, on computers or technology, and here's on modifying class sizes. I'll sort of go back and forth on there, and you look at the effect sizes on average are 0.12. This is over, about 60 studies. Here is about 40 studies, 0.15 for treatment with computers, and impact on learning, 0.117. And so on average, some of these interventions we're having have sort of substantial impacts on average, okay? However, other ones like treating with information, right? There's the one famous Jensen paper that has a big impact on information. All the rest have no impact, right? And on average, it's very small effect sizes, the point estimates. Treating with treating food and beverages, school lunches on impact, very small average effect sizes. Very few have significant impacts. Deworming drugs, the great deworming trend. We have to get all these kids in school, but once they get in school, they don't learn anything. I think that we are learning a lot, and I think I know that Duryea has been doing a lot of these sort of sectoral studies. But in summary, I think there's a lot more studies to be conducted. It's an accelerating rate. And we're really beginning to learn about what works and what doesn't work. Huge heterogeneity, by country, by type of intervention. And I think that, as we get more of that, I think that we can start to sort of generalize more about how to make these work in general. And what's clear, just to, we take this as in our studies and with our group is, we don't want to force families to send their kids to school if they don't learn anything or they don't have any impact on future outcomes. And that's really important because a lot of these interventions, you get kids into school, but they aren't learning anything. I think we need to think more about that. I'll come back to that at the ending of my comments. So how are methods changing over time? I want to spend most of my time on this because I think that we've seen, and I know our group deals with this. Sometimes we're browbeat into it, but we've actually really changed the way we worked over the past 10 years. This is our first experiment in China. We did some piloting work with some nutritionists from CDC, where we found very high levels of students with anemia. 39% of students in elementary school had low HB levels, and perhaps that was one reason for these huge performance gaps, right? So poor rural students were performing 2 standard deviations below urban students. And in a competitive exam-based system, this means you're never going to succeed. Okay, so we said, well, can we help plug that gap by treating this anemia? We did the standard, rigorous, randomized control trial, right? Stage 1, right? Do the baseline, select a sample, go do the baseline, get some test scores. Now pre-balance, randomized, 30 schools. We do the policy experiment, pass out a vitamin, stuff it down their throat with IRB approval. By the way, it's great. It's like, did you eat your vitamin? It's the guardian in Chinese schools is the principal, and so it makes it easier there. And 30 control schools, and then we go back and do the evaluation survey. The results. We got beautiful results. Out of all these studies on micronutrient impacts on learning, we've actually had a whole series of them in China, and that's probably because they got good teachers and good facilities, and the kids are just sick, right? And so you correct the sickness, and they do learn. Up goes hemoglobin points, down to anemia rates, and up go test scores, okay? big impact, right? Publishable. Of course it's publishable. We're very happy with that as academics. Policy impact. Well, when we came to the policymakers with this, it was like, well, who did it affect? Is it just the bad students? We only care about the good students. Compliance, right? Can we do this? External validity, cost effectiveness, et cetera, right? And we sort of shrugged our shoulders, right? So those are the great results. But it gets worse, and and this is it's been raised several times of publication biases and learning from failures, right? Here's another problem: is the big gap between going to high school in large cities. Everybody goes to high school in poor rural areas. 40% or less go to high school. Why? We've done a lot with money, right? If you give conditional cash transfers, you can get kids in school. But of course, in China, education is a decentralized expenditure by the local government. No one wants to spend money in education because as soon as you educate kids, they leave. Right? And, it's the rest of China benefits, but the local county doesn't. So they would say, well, how about information, right? High school conveys high future benefits. We almost know that for sure. The cross-sectional studies show that will likely be higher in the future. Jensen showed us if we just, gave out information, as all these kids will go to school and do better there, and it's inexpensive. That was what the policy local policymakers said, let's try this. And we did this nice big randomized control trial where we gave we actually replicated Jensen's, here's the high rate of return, you should go to school, just a single session information intervention. Then we did a whole career counseling program, and there was a control group. Did it in a big sample, we did the baseline, then did the interventions, we did the evaluation, and here's the results. No results, right? No impact of giving information, no impact of career counseling. Oh no, we did get information for career counseling. When we showed these kids the route through junior high, high school, on the college, and how you could develop your career, they said, I'm never going to make it. So they dropped out of junior high, so at a higher rate, right? And of course, so there's no impact on any of these things. So where are we going to publish this thing, right? This is my, when I retire, this is where I'm going to. And it's like you're saying, it's so hard even to get people to finish the studies and et cetera. And the policymakers, we had a lot of trouble. As soon as they saw this, we had these meetings with PACs. We call them policy action committees, not political action committees. But as soon as they see that, they lose interest, right? Because they want this to be their ticket up through the bureaucracy. So that was before. Let me come in. So this is the critique that's all over there, right? Valuations, impact, no impact. And of course, I think we are changing now, and I think that we're being forced into it. And we were being forced into it first. Now we fully embrace, really taking this sort of causal chain analysis theory seriously. Causal chain analysis helps address this major criticism, but it does much, much more. We use it to convince World Bank employees in the China office, who have never done a randomized control trial or evaluated any of their projects there, because they say, well, what can it do? It's just you can show us that we told the government it works, and so all we can tell is the government that it doesn't work. Government officials, NGOs, so that they don't know what it works, but what's the implication of it? How to fix it? How to make it better if it doesn't work? Even if it's working, how do you make it better, right? So theory of causal chain tries to get at all this. And it's really an underlying change in the way you go about setting up, designing the program from pre-analysis plans all the way to analysis. This is where I've given this several times in front of Howard, so you can jump up and tell me where I'm wrong. But I think this is the classical example of where causal chain analysis has come from and why it's so important. There was a Bangladesh Integrated Nutrition Project. It was a World Bank project. The problem they were addressing is there's lots of malnutrition in Bangladesh, and it was difficult to solve in the traditional institution structures, right? It's like all developing countries. The Ministry of Health doesn't do nutrition. Schools don't do nutrition. Who does nutrition? So what they did is they had a growth monitoring with nurses, nutritional counseling, teaching the mothers about good nutrition, and then supplemental feeding. And so one of the key parts of this was using these community nutrition practitioners, okay? And, instead of, a simple, right, 3-stage, impact, baseline, policy, experiment, evaluation, the evaluation of this, stepped back and took it very seriously about how we were going to get from this policy experiment to improved nutritional outcomes, right, through targeting of participants, different ways through the chain, through the mothers and the children. The mothers, the counseling, did they learn counseling? Did they change behavior of child nutrition? Or how about directly through the child, where we supplementary fed them, were there leakage, et cetera, et cetera, et cetera, and to map sort of this out. Of course, this was done in the Bangladesh program ex post, right? Because it was basically showing why, if you just do a traditional outcome monitoring or impact evaluation, is you can really go wrong. Here's what the bank's OED report came up with, or I guess their internal project report came up with, was that there was a big impact of the project on nutritional outcomes. Okay, so this is just simple post-treatment control differences. The bank agreed to scale this up. They're going to spend millions and millions and millions of dollars on here, but there was some criticism of it. So the evaluation department of the bank came in and they implemented this theory of causal chain analysis. And what they did was they drew this out and said, let's go figure out, when we go from the policy to the nutritional outcomes, what does it go through? And what they quickly found was that the basic problem, one, was that malnourished and growth faltering children, were they correctly identified? And this was the real basic problem, is that these nurse practitioners didn't even know how to interpret growth charts. So they were enrolling all the wrong kids into the program, right? Once they got in there, they came and they trained mothers. And they did a great job of training mothers who learned. So they figured, so as we went through up the cane, so they missed A. Once they got mothers in, they did a great job of counseling. Mothers that were counseled change of behavior. But the other thing that they forgot to do was that they found out that caregivers in about 50 or 60% of the time were grandmothers. Okay, and grandmothers didn't change, and they weren't counseled, et cetera, on and on. And you can sort of and so what they end up finding through the causal chain analysis is, if you targeted the right kids and got mothers into the program and counseled them, it actually had big impacts. But the project itself hadn't even realized that was the problem. Now, when they rescaled up the problem, the project, they took all those suggestions into account, and I'm assuming that the final project was better because of it. I've never seen the final evaluation of that project. But this causal chain is extremely important, and you have to do it not only. You have to plan your evaluation before. You have to find the entire sort of theory of design before, because it affects your pre-analysis plans, if you have one, and of course we're being forced more and more into them. Sampling, identification of outcomes, baseline surveys, design of the intervention, inline surveys. Let me just very, very quickly to show you how we embed this. The big problem, if you've ever been to a rural school anywhere in the world, you find that no kids have glasses on, right? But vision problems affect a very large proportion. We went and tested 5,000 kids in Gansu and Shanxi province. 25% of them were myopic, okay, but only 3% of them had glasses on. So 1 out of 8 kids who needed glasses didn't have glasses on. So the question is, can we improve education performance by providing eyeglasses to students? A huge change in the healthcare system if you were to try to put optometry into it. 2 approaches. We had a free glass project where we actually went out and put glasses on their face. The other one is we actually gave a voucher to the parents to take it in there, okay? There's our first causal chain analysis before we even wrote the proposal. I mean, right, exactly. But it changed 100% of everything we did. It changed our pre-analysis plan. It changed our sampling. Because when we really started thinking it through, you have to not only get the kids the glasses to their hands, they have to take the glasses to school, they have to wear the glasses, and then it's going to affect all these intermediate stages, their mental health, where they sit in class, their study habits at home, teacher attention, self-esteem. All that eventually is going to then affect test scores. And unless you get it through that, you don't know how to pick your sample. You know, we really wanted to know that if you charged kids a high price for glasses, like giving them a voucher when they lived 100 kilometers away from the closest store, is that going to affect their demand, and how much is it going to affect their demand? That affected the way we chose our sample. Is there a sunk, if those kids that come and pick up those glasses and take them back, will they value them more? Is there a sunk cost argument to do that? And it affects your survey design and your analysis, because you want to figure out not only the project does work or not, who it works for, if it does work, if it doesn't work, why it doesn't work. If it does work, how could we make it better? When you approach policymakers with this sort of package, suddenly they're actually much, much more interested in collaborating, because they see if it fails, then perhaps they can still learn and improve. So final thing, I'm just going to skip through this really quickly, but because I think that our studies finding and making their way into policies in developing countries. Like I said, I only work in China, but in part response to the availability of evidence-based research from a very early work that conference that 3IE ran with us, with the Ministry of Finance and with the State Council. That's the President's cabinet. China's created a system for connecting research and evaluators directly with the top leadership. I mean, this is what we say. This puts China so far ahead of the U.S. And basically, the system is twofold. On the left is a 4-page evidence-based policy brief. 4 pages. And it can't be 5 pages, can't be 4 pages in one sentence. It's 4 pages where it's the problem, and then you go through what's the policy that's out there now, what's the problem with it, and then how you can offer solutions. Within a month, they come back, and the top leaders, so this was our nutrition brief, so Wen Jiabao, who's now the ex-premier, Li Keqiang, who is vice premier and now is premier, and Liu Yandong, who is state councilor, who's now vice premier in charge of health and education. They will come back and they will actually sign into policy action based on this. Or they'll come back and say, this was on our reading list, we found it interesting, or they'll ignore you. Okay, they'll actually send it back and say thank you, and which meant that it wasn't act. You can submit an entire set of policy briefs, and they will encourage you to continue to follow projects over time. We had 17 policy briefs, 6 of them were on nutrition, the need for nutrition in schools to overcome this problem. And there's this dialogue that goes on through these that comes straight through this system that really has evolved a lot out of this new evidence-based impact evaluation system. It doesn't mean it happens without concerted effort, because health, education, nutrition is such a decentralized system. You also need to work with local leaders, and so it's a back and forth. That getting upper level approval, working with these local policy action committees, it's an iteration that needs to go on. And China now has a $20 billion nutrition lunch program, has a new financial aid fund for poor kids at high school that never had financial aid before, and has deworming campaigns in 62 poor counties. We're working on a 3IE study that wants to extend it to 692 poor counties, which are all the poor areas in China. Lots and lots of other people worked on this except our group, but it went up through this system, and other researchers are involved in that too. So in final, where do we go? I thought that I wanted to echo everything Bill said about we need more, we need to cluster, we need to replicate. I think the thing that we find out that we need more is we need long-run studies. And I think that that's where we run a lot of short runs. We're guilty as everyone else. And I think we need to try to go see those. Michael Kramer just gave a paper on, you get kids in school, it doesn't have any impact on learning. He says now we find impact on labor markets. It didn't help them learn, but they were in school. Maybe they got disciplined and it helped them get, that's his sort of story there. True or not, I think we need to replicate that and find it. And then cost benefit. I don't think we take cost benefit seriously enough. And so those are my two suggestions. Thank you very much.
Well, that was 3 really wonderful presentations. I think each of them provides a lot of food for thought and for discussion. How are we doing? We have some time. So maybe I could start by asking a couple of questions directed to one or more of you. But before I do that, I wanted to do an advertisement because Scott mentioned this finding from Patrick McEwen's paper that what gets children into school doesn't necessarily lead them to learn. We have a CGD book coming out by Lant Pritchett, which makes this point really beautifully. You can't forget it if you've read this book. It's called The Rebirth of Education. Schooling Ain't Learning. So I think that's coming out in a couple of months. And everyone in this room who's interested in evaluation and impact evaluation will want to look at that book. So let me just throw out a couple of questions. One is for Suzanne. You made this interesting point about failures in getting impact evaluations going. I wonder if you could say anything about, with all of the work that's gone on in the IDB, how have there been some failures of the programs or projects or interventions that were evaluated? And can you say something about that and this issue of publication bias? And I think that would be very interesting. And one thing that occurred to me is I think that we've learned on the Progresa Solidaridad program, which was so important in generating interest in evaluation in the first place. And now, in fact, the architect of that evaluation, in a way, Santiago Levy, is at the IDB in a leadership position. But one of the things that seems to come out of that is that it has made a difference in alleviating poverty, but the evidence that it actually changes whether children get to school, in the case of education, is not nearly so clear, or the impact, if there is one, is much smaller. So I don't know if that would be an example of failure which has been very well, it hasn't been hidden, certainly. I had a question for Scott. This causal chain, this is really a question for Scott or any of you. Your point about the causal chain analysis was really interesting. And I'm trying to understand whether it goes to the heart of the larger critique of impact evaluation and particularly of randomized controlled trials, that they fail to take into account the systemic issues that are often politically or bureaucratically problematic. And for that reason, I was kind of fascinated by your examples coming from China, where then you proceeded to say but maybe that's the next session, use. So we won't go there. But particularly Bill, maybe, because we have this larger critique from economists who are concerned with big development. Is all this micro impact evaluation failing to get to the big story of whether it isn't either growth or political reform or democratization and accountability mechanisms that fundamentally change the lives of people in the medium term? Maybe each of you who wants to say something about that would be good after Suzanne answers about failures.
I would say that one thing we've learned is it's much easier to affect policy change when you have a positive impact results. So, when we were able to show that CCTs had positive impacts on utilization, and that was replicated over and over, the take-up, was almost universal across the region. Now we have a series of impact evaluations that show that distributing laptops doesn't in and of itself have fabulous results, but there's a lot of demand among governments. They think this is the way to go, and so I would say that dialogue has been much more of, oh, okay, well, this study didn't find that, this study didn't find that, but what if we tweak it a little bit? We want to do the program in a different way. So finding no impact doesn't have the same result in the policy dialogue as finding a positive impact.
And what about people inside the bank who are developing lending operations? Do they, on the laptops, for example, do they still want to include laptops at least as one part of a larger loan?
There's a little bit of a struggle whether you're part of the project team or you're coming at it from the research angle. And depending on the country and how open they are to including evidence-based policy in their project, you're going to have more opportunities to go in that direction. So this is why the dialogue with the country is so important, and to be able to include experts in evaluation in that dialogue, so that you can bring that angle in and kind of at least if they're incorporating that type of angle into their project, you can convince them to evaluate it, and then in the second phase they can adjust their program based on the evaluation results.
Yeah, it's interesting. It's hard to not leak into the next session. But Bill, do you want to say something about this system issue? If you know what I mean.
Yeah, I do. I mean, this it comes up in any field that one of the critiques of a lot of the impact evaluation is that it's looking at micro things, and that the big stories of development, whether it's at writ large economic growth or in a particular system, you might find a good way to educate or a good way to provide health care, but what if you implement that in a health system that isn't functioning? What's the political economy of the health system or the education system? And it reminds me that when we were doing the evaluation gap work, the big question of the day in the aid community was about budget support versus other kinds. And said, well, we're never going to do a random assignment of budget support. How can you do that? And Nick York was in the conversations, I remember, and he sort of came to this conclusion. It was like, how would you know that budget support was working? And the way you might test that is to look at a country where there was budget support before and after and say, is it allocating its money better, more efficiently than it did before? Well, how would you know it was allocating its money better? Well, you might see that it's allocating money to programs that are proven versus programs that have positive impact and programs that don't. Well, how would you know which programs actually have positive impact? Well, you need to have micro studies to do that. And so my conclusion out of this whole thing was that these are hugely complementary pieces of information, that if I'm going to do a political economy of why education is so hard to make function in a particular country, it helps me to know what motivates kids to go to school, why parents behave the way they do, how the teachers function on a labor market, lots of micro studies. but I can't do my system thing without that other piece. So that's why, as I said when I conclude, it's more. We need to set up another sort of system gap of a working group or something if we want to handle the other stuff.
And just, I don't think causal chain analysis, how it's being applied now, gets at this question.
Right. Particularly in China, where this other question
right,
is
or
less problematic, maybe, as you've
no,
suggested.
but I think that I think that it could be. You mean the question of does the education system work, or does it work for what? And it's going to be evolving as countries evolve. So I mean, I think that the issue that William just talked about is needed, and it's valid for doing these studies. I think what causal chain analysis can go more towards is broadening itself back and thinking about. We don't think about the long run implications. We also don't think often about the general equilibrium implications of what we're doing, and measuring those are difficult, but it also often has to be. We're generating the pieces that can be put into a modeling framework, and so if you do suddenly get everybody into high school, what's the implication for returns to high school, and you better take those into effect as you're doing your cost benefit analysis, or try to integrate it with other programs for employment and et cetera, et cetera, et cetera. So I think that we need to expand our causal chain analysis even further, put it into sort of more of this long run and general equilibrium analysis, which then will make it fit better, even give us more information to help us attack the system problems. So it's so I think.
Okay, let's turn to those of you. I know there are some people from the World Bank, so it'd be interesting to hear how it's all working there. Please introduce yourselves. That's okay. That's okay. You don't have to be from the World Bank.
I'm Shangita Mukherjee. I'm from the Department of Global Health at George Washington University. I just had a couple of questions. I was listening to Suzanne talking about the policy views on negative or non-conclusive results. And I was just thinking that, I mean, in my experience, using a theory of change approach often can help with salvaging even negative findings or non-significant findings from a study, because you do get hopefully data on all the boxes and some of the arrows even, and you can then have a dialogue with the policymakers around investing and improving those things. Another thing that I want to bring up is that for some of these macro level questions, the systems gap and the systems level, how are you going to randomize a budget support sort of intervention or whatever you want to think about? I've been working a lot with case study methods and improving case study methodology. And it seems that often is what we have to rely on when we're trying to ask these questions at the macro level. And that's, again, where the theory of change becomes really, really important, because if that's also hanging together between the micro and the macro kinds of questions, it helps link and forge that sort of body of knowledge so that you can see a continuity. And I know that Howard was also in Copenhagen, I think, last year on a workshop on trying to improve case study methods for development evaluation. So I know that there is a lot of debate and dialogue and progress being made. So maybe that can be talked about also. Okay, great. Thank you very much.
What I'd like to do is take a few comments and then turn back to all of you. Barbara?
So I'm Barbara Bruns, and I am from the World Bank. I just wanted to first ask Suzanne about something that seemed a bit of a disconnect between you and Bill. When you talked about all of your data were basically about the percent of IDB projects being evaluated. And Bill's point was that you have to split off the evaluation of programs or interventions that are being funded by projects and not really try to do an evaluation of the entire project. They're different types of evaluation. And so the way we have been doing this in the World Bank is trying to be strategic about our limited funding for impact evaluations, for example, through the Strategic Impact Evaluation Fund, formerly the Spanish Impact Evaluation Fund, and try to identify themes or topics or areas where we feel we really need to build global evidence, and to then open that funding to people across the bank that are funding or are working on projects that have those kinds of interventions embedded in them. And I was just wondering, maybe that's really what you are doing at IDB, but is there kind of an explicit identification of research topics that you're trying to build evidence on within your sectors? And then, Bill, I was struck by your graph showing the big increase in impact evaluations after 2007, but before IIIE. And I think it'd be fair to have another arrow in there indicating the creation of the Spanish Impact Evaluation Fund, because in those 3 years we launched with $4 million per year in funding from Spain. We launched over 50 rigorous evaluations in just the HD sectors. And if you compare the volume of that financing to what IIIE is doing now, it was huge. And we're very lucky now that DFID has stepped in and is continuing the fund. But for someone who works on Latin America, it's unfortunate that now the fund is focused on low-income countries. So I feel like we're missing a lot of opportunities to generate evidence from Latin America and other middle-income countries.
Smita. I forgot to say that Smita is also a member of the board of the Center for Global Development.
Thank you, Nancy and Bill. So my question is mainly for you, Suzanne, but I'd love to hear others chime in on this. Suzanne, you mentioned when you were talking about, I think the figure went up to now 38% of projects actually at the sort of outset have an approved evaluation design. So I'd like you to tell me a little bit about the other projects. Is it because they just haven't gotten to the stage of getting evaluation, or are some of them already, how should I put it, proven interventions? And then the second part of my question is, to what extent do you see on the demand side, so on the project design side, the teams that are putting together the loan packages, to what extent when they're thinking about the types of projects they're going to fund, are they proactively going to the literature, or are there any requirements that either you have to be explicitly testing your intervention, or it has to be one that already has a supportive, rigorous evidence base? Are there any sorts of such institutional requirements that you're seeing?
Okay, I think should we do one more? We've got, let's have you, any of you who want to address any of those, do so as quickly as you can, so we can have another round. Dan, you got a couple of specific questions, but I would invite Scott and Bill to comment on, particularly maybe on the case studies, but also on the questions about sort of how the Inter-American Development Bank, but it could be applied to any of the donors, really makes these choices.
I'll try to be very brief. So I would say that we try to approach the impact evaluations with a very strategic focus, and the challenge is that the funds are broken up. We don't have one strategic fund dedicated for impact evaluation, and that has implications about how strategic you can be. So that means that these decisions are being made within other parameters, other criteria. So when you apply to the social fund, you say, this is a very important question that hasn't been answered before. This is the opportunity to answer that. But you have to, whether you get funded based on the evaluation question is going to depend on some other things. And the reason I highlighted the MIF is because they do have one fund available for evaluation, and they're not going to say, oh, we're not going to fund this project because we have too many projects in this country, or it's based on the strength of the evaluation. So the evaluations are, and the dialogue is definitely based on theory of change. We try to bring that in as much as possible, and you're absolutely right, that does help. And certainly when you're writing a project and trying to bring a project to the board, you would bring in the existing literature, And then if there is an existing literature, this is where you would justify, spending the resources for an evaluation, because this is where you could learn something new and innovative.
Well, I want to say Barbara's right about the Spanish Impact Evaluation Trust Fund, and I just want to sort of as a riff on that the IDB, the World Bank, these organizations are large enough to have a lot of moving parts. So I put DIME up there because that was the one that's sort of on my mind. But the World Bank has, a research department, evaluation department, their trust funds. There are a lot of different things going on. I guess the SIEF is probably the largest funder of impact evaluations in the World Bank. And it just reminds me that since setting up this newsletter, I've had contact with a lot of small organizations that are saying, like, we want to do more rigorous evaluation. I did some work at the Inter-American Foundation, which has fascinating programming, but nowhere near the scale to be able to do this kind of thing. And it just sort of emphasizes the point about there being a collective process here, where if there was something the Inter-American Foundation were doing that was an intervention worth evaluating, who would finance that? And so this is why I think we need to get out of the organization, entity-specific stuff and into funding something more independent like 3IE as a place that this money can be selectively raised, but then used and targeted to the kinds of things that can all of us can benefit from.
I'm gonna interrupt just to say that Bill has said artfully and politely what maybe he knows I've been complaining about for several years, which is that the World Bank did not bring its expertise and its experience and its resources, even if modest, to the IIIE. It's still not a member. So some people think maybe it's just as well because the World Bank is so big and, in fact, can make a lot of contributions, tremendous contributions. And this is not directed to Barbara or yeah, exactly, or anyone who's here. The World Bank is a very mysterious place if you're not inside it. So it's not really clear who's thinking about that decision or even if it's on anybody's agenda. But maybe those of you who are insiders on the evaluation community will urge Howard to keep it on the agenda in the medium term, although it's much more important to have the developing countries joining the IIIE than to have the big guys in Washington in the IIIE. And, of course, the World Bank makes a huge contribution without being a member. But this goes back to my quadruple IE, in a way, that it's better for everyone to have at least one institution out there that is truly independent. Scott, do you want to say anything about the case study issue?
Yeah, it's just about the case study issue. And, so you map out your causal chain, and then the key, of course, is you have a certain amount of resources that you want to then analyze this, and you have to you sort of pick your winners on is mental health, going to be a big issue? Do we want to spend a lot of time surveying mental health? And you go down, and we have a checklist of different approaches to look at each of these nodes, right? And survey design, of course, right? Baseline and evaluation survey. Secondary data, right? Schools, clinics all have secondary data. Experiments of behavior, right? So actually embed experiments into there to try to elicit risk behavior or et cetera. Then case studies or even long-term embedding of observers. We've put students who are doing student teaching actually as teachers in schools and had them live in these boarding schools, and it's a gold mine of information, right? And observers. And so I think that all these play a role, and I think case studies are probably underutilized and need to be greatly amplified to be able to pick up these notes. So I'm a big believer in, I think it needs to be more systematic. We aren't very good at it. Okay, so good, excellent.
All right, let's go. I saw some other hands. Yeah, please.
Okay, Chris Nelson. I am from the World Bank as well, though I'm very new, so I don't know the mystery yet. My question is to Scott in terms of, again, the causal chain issue. For me, there's two aspects to that I'd be interested in a response from. The first one is in terms of incentive. The incentive within organizations like the World Bank to engage in the causal chains as opposed to just simply projects or standalone programs. And then the second part is the skill set that you take to that whole negotiated process around causal chains. I'd be interested, Scott, in your thoughts on just how difficult it is for people to get their heads around dealing in that space and moving across from the very strict parameters of doing experimental work to one where it's a messy, complex, chaotic notion of how you line up ducks and drakes in the right way to get better outcomes in relation to the evaluations that you might then undertake, whatever form or methodology. So they're the two issues.
Okay, I have to ask everyone to try to be, including the panelists, as brief as possible if I'm to provide the public good that moderators are supposed to provide, which is to finish more or less on time. So, yes, I saw, right.
PS Population Services International. There's just a comment on from Scott on the causal chain analysis in your story from around what happened in Bangladesh. It sounded like a really good process evaluation was as critical as doing a good impact evaluation. And I guess a question for all of the panelists is, how does a process evaluation perspective or implementation science, how do we do what we do in order to get what's effective? How does that fit in with the impact evaluation agenda?
Great question. Yes, please.
I'm the Director of Learning Evaluation Research at USAID. And one of the things that we found in such a bilateral organization is that we focus on, we focus on the causal chain and the planning side. So USAID in the last couple of years has done a lot of reforms to work on causal chain being identified in the strategic planning as well as the project planning. So then when we come back as the evaluators, we have that basis already there. And so it doesn't become a function of the evaluators to establish the causal chain. Could I just say one other thing? I am finding, and I'm sure that this is myopic being part of the U.S. government, but I'm feeling a little bit like MCC is the elephant in the room. We haven't mentioned MCC. But you haven't said a word, Jack.
No, he had his hand up. I was going to go. He's got the mic. He's got the mic.
They've had such interesting experience in the last year that in terms of what we've learned on impact evaluation, I was just looking forward to hearing more about that.
All right, you have the floor. Let me say before you talk that Ruth Levine, who was behind with Bill, When Will We Ever Learn, had a big role, I believe, in setting up the renewed evaluation policy at USAID. And we also know that MCC has really taken a lot of good leadership in this area. So tell us about it.
It's working? Yeah, no, it is. I'm going to ask a question instead, but I'm going to preface it with a little bit of my background at the World Bank and then questions that we're struggling with at MCC. Marcus Goldstein, one of the great public goods to our community, likes to start out his discussion of impact evaluations with this characterization of the world being divided between two types of people. There are those who know and those who know that they don't. One of the challenges that we face in doing evaluations of our projects is the reality that those projects that are being managed and designed by people who are really struggling to find better ways to do things are those who are most amenable to impact evaluations, which really get at questioning the program logic. But a very large portion of the large programs that we do are implemented by those who already know what they're doing, and for whom these are people for whom impact evaluations are an impediment to their getting the money spent. And one of the challenges that we have is a challenge that Marcus has highlighted in a blog from about 6 months or so ago about what is the purpose of the impact evaluation. Do we use the impact evaluations to learn about the theory of change, or do we do it for the purpose of what he calls judgment? We actually prefer to refer to the concept of accountability. Can we say what the costs and benefits of a program are so that we can assess whether or not we are good stewards of the public funds. I'm getting to the question. Very fair. My question is, to what extent are we concerned about a selection effect, that the evaluations that are done by those who are eager to do evaluations may actually be systematically misrepresenting what the benefits are of programs and how effective the program logic is? And what is, and this is the question that MCC struggles with, what is an appropriate balance between doing impact evaluations for learning, what is the program logic, and what is the role of impact evaluations to better understand how effectively we are spending public funds?
Okay, I apologize to those of you who had additional questions. I think, it's reasonable to give each of our panelists 2 minutes, and we won't be too far behind, to say anything you want. Let me add, I hope, Bill, you'll also address the question about process evaluation, because I know you've thought about that in the context of our joint project on cash on delivery aid. I always get a chance to say cash on delivery aid.
Okay. I'll respond to 3 things then, I guess. The first one, just on MCC, I want to mention MCC has come out with recently 4 agricultural extension impact evaluations, perfect example of clustering, and I did a couple of blogs on those as well, and they're really worth, the studies, not the blogs, the studies are really worth looking at. And MCC is making a very strong effort in that direction, so if you don't know their experience, it's worth looking at. I want to pick up...
Were they judging, or about judging or learning?
Yeah. I would say they hit the balance. They hit the right balance. And they also, one of the things that they learn not only about the agriculture extension, but also learned about the process of impact evaluation, because each of the evaluations ran into different problems. So there's a lot of substance there to get from that clustering around a topic, or within a group, or within a particular series of interventions or something. I want to come back to whether this should be 4 IE instead of 3 IE. Independence, people use that term all the time. They're usually in the context of impact evaluation thinking about being unbiased and about signaling credibility. But when I'm talking about an independent organization, or when this came up, it was much more about being free from the bureaucratic pressures within organizations and being able to look across the full spectrum of interventions and be selective about where we can learn the most, rather than, and that's part of dealing with this learning judgment. Within an organization, you have to be heavier on the judgment side than the learning. But outside, you can be much more heavy on the learning and less on the judgment. And finally, on process evaluation, which also gets to the big development questions, it seems to me that a lot of process evaluations that I remember in the 90s were very weak because they didn't have the impact information. And a process evaluation that can also link all the thing that it got to what happened in the impact is hugely effective. An impact evaluation study that has that process evaluation is really, really useful. So these things are, and I've used the word complementary before, they're very, very complementary, and it's a very part of that. And especially as you start moving into larger system questions like the case study approaches, that's essentially what you're doing. You're gathering information about the whole causal chain, if there's a chain, or the system processes, along with very key information that you've seen some difference relative to what you would have expected under some other circumstance.
So the process evaluation is an input to the causal chain sometimes as well.
Yeah.
Yeah. Suzanne.
So I would say that this increase in the quantity and quality of impact evaluations that's happening at the IDB, is a fundamental change. You see certain sectors such as early childhood education where governments have now incorporated this evidence-based knowledge into their policy making. They're not only, borrowing, but they're incorporating that into their own programs. And there is an opportunity for the financing and programming of the impact evaluations at the IDB to be more agile, to be more strategically focused. But overall, I think these are very positive developments, and I just want to, congratulate Bill, CGD, 3IE, JPAL for the dissemination efforts, because this really represents a change in the mindset of an institution, and in changing this paradigm is not easy. So these dissemination efforts were very successful.
Yeah. So there was a couple questions all sort of around the same theme of, how do you actually decide how deep or how you approach creating your causal chain analysis, and what are the incentives in organizations to do thorough ones or to do them light? What we do is, I think our basic premise, and I think every basically rigorous impact evaluation team has to do, is we're going to do causal chain analysis. I mean, we have to. If we don't do it, it's just not even worth doing. It's like, do we have enough power to do it? If we don't have enough power to do it, we can still learn stuff, right? We can still learn stuff when we don't do. But if you really want to do rigorous impact evaluation, and you have to do it. Now, the question is how much do you engage your partners, right? And how much do you, and you want to, and some partners are very amenable to it and are active stakeholders in it, and others aren't. And it has back to those who know and those who know they don't know. And you sort of make that judgment. And I think that it makes it much more richer if you get those who know they don't know and who are incentivized to really figure out if it works or not, et cetera, et cetera, et cetera. But you still got to do it if you don't. The final thing is back to selection effect. And we really think of sort of as the bench scientists. There's efficacy studies, effectiveness studies, and upscaling studies. And I think that we try to really divide between those. The hardest one and the most important one that we're dealing with, especially right now, are upscaling studies. Is once you've convinced them to do that, can you get them to hold off one more time to then allow them to upscale, and then let the government agencies, organizations do it in their way, perhaps with guidance and that kind of thing, and evaluate along the way. It's really hard to get money to do that, and it's hard to slow down governments to do that. But I think that, so you got to worry about, there are selection effects, especially in efficacy studies, there should be. We're trying to find out. But then it's effectiveness studies and then upscaling studies that we have to start to worry about the biases from that. So, and I think thinking about it that way helps you really assess the generalities and external validity problems.
So I'm going to use my spot as a moderator to pass on to Howard and other colleagues at IIIE of all these things, so many rich things said today, really, already in this panel. But two things that I'd see for the future. One is this financing issue that Suzanne raised. Is the MIFA model, and within countries. And I don't know if it's in the remit of IIIE to worry about that kind of thing, as opposed to the substantive issues around evaluation, but maybe it's a good thing if you could do it. And the second is the idea that came up of long-term, how to deal with looking at issues over the long term. And I've been worrying about that because of this schooling ain't learning issue. What is the psychological effect on children of sitting for 5 or 6 years in a classroom, just getting the sense that they're failures and they're stupid? It has to be deeply problematic. Now I want all of you to join me in thanking yourselves and the panelists. We have a short coffee break. We're supposed to start again in 5 minutes, so let's take 7 minutes. But please, thank